Z22 Magazine, Z22 TV, parce que ta vraie histoire doit être racontée par toi-même.
Chers téléspectateurs, bonjour, je suis Adeline de Z22. Aujourd'hui encore, nous avons ce rendez-vous pour vous parler de nos problèmes quotidiens, les problèmes que nous rencontrons dans nos communautés de chaque jour, les problèmes qui affectent notre vie, notre santé de chaque jour. Donc ce mois, c'est le mois de décembre où nous parlons généralement de santé sexuelle, de VIH SIDA. Donc aujourd'hui, nous venons rencontrer un éminent personnage, un homme qui a travaillé dans le domaine du VIH SIDA, qui travaille avec des gens chaque jour qui sont affectés et infectés par le VIH SIDA. Donc sans plus tarder, et pour pouvoir partager l'expérience de cet homme que nous avons devant nous aujourd'hui, nous allons lui dire bonjour et lui demander de se présenter. Good morning, Mr. Badru.
Good morning.
Yeah. Could you introduce yourself to our friends who will be watching us soon? Yeah.
My name is Badru Male. I'm originally from Uganda, and I came to this country in 1990.
Mm-hmm.
My profession originally, I'm an engineer, civil engineer, who worked as an engineer for 10 years. Engineering is very good. My specialty, civil engineering, is a profession that deals with the welfare of people. And you work with people and see how they improve their lives, their quality of lives. So when I came to this country, I found out that my community, the African community, and especially the Ugandan community where I come from, they were in need of another service.
Okay.
And this service was to do with their health. At that time, many Ugandans were dying of HIV and AIDS, and they had no support at all. So my interest changed from civil engineering to addressing health of the community.
Okay. So you mean that is what triggered you to move from engineering to taking care of people in the community?
That's right. That's what engineered me. But of course, it was not straightforward. It was step by step. The more I got involved in the health of the people, the more I needed more information and knowledge, and that's how I completely changed my career.
So today we can say you are an expert in sexual health promotion.
Yes.
And then partly HIV AIDS.
Yes.
Yeah. So how did you become expert?
Well, in 1991, when I started volunteering with HIV/AIDS organizations, I found out that actually I needed more knowledge, and I had to go for a degree of health studies to understand how health issues affect communities, and that triggered everything. And afterwards I had to go and specialize at University of West London to study HIV medicine, and that's how I come to be a professional in HIV, and especially in public health.
Oh, that's a good point, because most of the time when we come from Africa with our background,
yes,
we think when we come here we can just go straight into what we know most and we can do. But that means also we have to try to go for training and update our knowledge, and then maybe change career to become better. So this is the idea, people, please, if you come, just try to readapt to the situation. And
absolutely.
Then, yeah.
Absolutely. And there are not so many facilities, there are so many opportunities, and it is better to choose such opportunities that your communities will benefit from.
Mm-hmm.
Yeah, there was no point for me to do aerospace engineering when actually I know that my community won't benefit from that. So that's why I took public health.
Oh, that's good.
Yes.
Okay. Now we talk about your background, your experience. Now, could you please give us a briefing of what's going on in the world and in the UK regarding HIV/AIDS? What is here? Because this is the month December where we talk about HIV. We talk more about HIV/AIDS. So what is going on in the world? What can you tell us? What can you share with us?
Yeah, my experience starts as far back as 1991, as I said. At that time, HIV and AIDS was not known as much as it is known today. And at that time, there was no proper treatment for HIV and AIDS. So you can imagine that many people who got infected actually died without being treated. By 1995, there was some kind of achievement when combination therapy to treat HIV was licensed, came on board, and people started living longer. However, these drugs were so toxic that many people suffered many other side effects. And people started believing that it was a conspiracy to kill those who are already infected. Now, my job there was really to convince people that these treatments work. And it was really a very tough job to do, especially within the African community. Yeah. But afterwards, the medication improved, and people started to develop faith in the medication, trust the medication. They started using it, and they started living longer, which is quite a very good thing within the community, with African communities. As time went on, many African community settings, religious settings, cultural settings started to adopt these programs and raised awareness within those communities and reduced the amount of stigma people had about HIV and AIDS. And people trusted medication, and everything got better. However, as time went on, we found that definitely people were not dying, so there was a bigger number of people living with HIV. And this big population of living with HIV, not everybody knew that they were HIV positive. And that's why the latest campaigns at the moment are very, very much focused on people to test for HIV.
Okay.
Because those who do not know that they've got HIV, they are the ones who spread the virus without knowing.
Okay. Talking about testing for HIV,
yes.
What kind of test is it about? If you can tell us more about testing for HIV. Yeah.
Testing has also improved. In the past, they used to test people and they get the results within 3-4 weeks.
Okay.
Nowadays, there is what we call rapid HIV test, or testing at the point of care, whereby they take a bit of blood from your fingertip, and then they tell you there and then within 30 minutes that you've got HIV virus or you have it.
Okay.
Now, though these tests are very good within the communities, but they are not conclusive.
Okay.
Sometimes they may give a false positive, sometimes they may give a false negative.
Which is?
Which is, yeah. Well, you don't have HIV, but maybe you are HIV positive.
Okay.
So always a conclusive
test.
Full HIV test is necessary.
Okay.
And that is a blood test, whereby the blood is taken from your veins, taken to the laboratories, and they check for the HIV antibodies. When you have HIV antibodies, it means actually you've got HIV.
Okay.
Yes.
So that means the first test that you were talking about is a quick one.
It's a quick one, it's a rapid one.
You can't rely on that to say I have or I don't have HIV.
Yes, it may not be conclusive.
Okay. So that one, do you need to go to hospital to have that test done, or you can go anywhere else?
You can go to centers within the community, the GP surgeries, accident and emergency, and some small clinics within communities. You can do that test.
Okay.
Yeah. Nowadays, they are trying to target other centers where people are at risk. For example, centers where people who use drugs go for rehabilitation.
Okay.
People who are involved in sex trade, where they are. So to target people who are at risk. In such places also they are trying to put some establish rapid test services.
Okay. So for the main test that can prove that you have or you don't have HIV,
yes,
you have to go to the hospital.
You have to go to hospital.
But can you go yourself or you have to be referred?
No, you can refer yourself,
okay,
walk in and request for an HIV test.
Okay.
Or somebody can refer you, but you know, anybody can just go in and have a test.
Oh, okay.
Yeah.
All right. So during your experience, do you come, I know you work a lot with black African communities
Yes.
in the UK.
Yes.
So do you think they come forward to have to accept the services that are available in the community?
Though I said that HIV stigma is reducing within the African communities,
Okay.
but it is still there. The problem is the perception of health of most African people is I am healthy as long as I'm not ill.
Yeah.
So when they are not ill,
I'm standing,
I'm walking, I'm eating,
Yeah.
I don't have any pain,
Yeah.
I'm healthy.
Okay.
So with that perception, it's very difficult for people to walk in and say, oh, I think I need an HIV test. However, we see that women, African women, are increasingly being more conscious about their health than men. So women test for not only HIV, but all other infections more regularly than men.
Well, what could be the reason why men don't come and women are more to come for the?
I think naturally women are very conscious about their health.
Okay.
They look after themselves. And naturally women are carers, so they want to care about themselves first.
Before caring.
Men, we always think that we are macho, we are strong, and accepting that I have an illness is a sign of weakness. So we always try to say, well, I'm okay, everything is fine, and we don't go. Now the danger in that is, by the time you go for a test, it may be too late.
Yeah, late. It could also be the fact that they work a lot.
Yes.
You know, in this country, people do like 1, 2, 3 jobs a day. So it might be those kind of reasons why men are more likely to not go to the services than the women.
Absolutely, absolutely. Men work a lot, and health, as in their own health, is at the bottom of their priority list. Yeah.
Okay.
That is an issue.
Yeah. Talking about stigma, could you give us just a little bit a hint about what kind of stigma could be in the community regarding HIV/AIDS, especially black communities?
Black communities, most of black communities, they belong to different faiths, for example. Okay. And many actually are Christians, and they go to the church. Once the church knows that somebody is HIV positive, of course they need to support that person. And how are they going to support that person? In most churches that really support people, they request the church members to give support to the person who is HIV positive, thereby openly breaching their confidentiality. Yeah. And when people's confidentiality is breached in such settings, they're discriminated against. People don't want to go to their homes, people don't want to sit near them, people don't want their children to play with their children. So that kind of stigma is still there. Unless really there's another level of awareness by which people will understand that you cannot infect someone by sitting near them, by drinking from the same cup, by using the same toilet, by actually using the same bedroom, then that stigma will still be there.
So do you think that's still in the community, where people think when you shake a hand, when you share cutlery, or when you, they still think you can catch HIV?
That's right. Yeah, it is still there in certain communities.
Okay.
And also in the African communities, those who have not come forward to raise their awareness about HIV, they still think like that.
So that means there's still more work to be done.
There is still more work to do, a lot, especially targeted prevention and targeted awareness of HIV and AIDS. Targeted, I mean people from different faiths, like the Muslim women, they have got their own perspective. The Christians, the Catholic, we know that the Catholic don't even
want to talk about
condoms. They don't want to talk about using condoms as prevention. We also have other settings like French-speaking people, people coming from French-speaking countries, the Portuguese-speaking, the Eastern Europe, Polish-speaking, or whatever. So this must be targeted within their communities, taking into consideration their culture and their faith.
Okay. So you work with mainly black communities.
Yes.
Do you come across, as you say, French-speaking, because I'm from French-speaking country, so
Well,
I just want to know if you come across those people who speak French and come to you for services.
Yes. There are French people coming to me for services, but when we talk about prevention, it is giving them a message, giving them awareness. Many people actually don't grasp what we present to them in English.
Okay.
They need specifically people who speak French.
Okay.
So that is a gap in service provision, whereby we need people from the French-speaking countries to deliver sexual health messages to people who originally speak French.
Okay.
Yes.
But then I know that all the charity organization, they broadly said they're working with all African communities.
Yes.
But you say now they still have a gap there. So what can be done is what you're suggesting now. We need a specific service provider speaking that language.
Yes.
It's valid for Portuguese, it's valid for other languages as well. So we need a specific service delivery for these specific communities.
Absolutely,
Right.
yes.
Okay.
Absolutely.
All right. So as a specialist, I know you meet, as we say, you meet people on a daily basis. So what do you provide as service? We know there is a prevention, but we also know that there's the other way of supporting people. People are already infected by HIV or affected by HIV. So what kind of service do you provide to those people?
Right.
How do you support them?
People living with HIV, they need support to understand the medication, to understand also HIV, how it affects their life, to understand the medication in order to comply with the medication. And also, we providers, we have a duty of what we call secondary prevention.
Okay.
Secondary prevention is about preventing of onward transmission. People living with HIV, not to transmit the virus to other people.
Okay.
So we look at it both ways. For people who are not HIV positive, not to get infected, but also for people who are positive, not to transmit.
Okay.
You see? And these days, as science has improved and the knowledge about HIV has improved, we find out that people who take their treatment, those who are positive, and take their treatment religiously as it is prescribed, and reduce the amount of virus in their body, are less likely to transmit it.
Okay.
So when you help somebody or support somebody to adhere to their treatment so that they keep minimum amount of virus in their body, then you are preventing transmission to occur. That is secondary prevention.
Okay. So you're keeping the person safe.
Safe.
And healthy.
Yes.
And then you preventing other people to get infected.
Yes.
That's a great job you're doing. Yeah. Very great job. Now, we are wearing a sign here. How do you call it?
This ribbon is a ribbon of awareness.
Okay, the red ribbon.
The red ribbon.
Okay.
This red ribbon marks, well, awareness is all the time, but usually in December, that's when we mark the World AIDS Day.
World AIDS Day.
World AIDS Day.
Okay.
And the World AIDS Day started way back in 1988. So this year we are having the 26th one.
Okay.
Okay? So.
How many?
26th.
26.
Yeah.
Okay.
So every year there is a theme.
Okay.
And these themes are, one, to encourage people to go for a test, to encourage sections of the community like the youth, the women, the men, to be aware of HIV/AIDS, to encourage or incite the politicians, the civil society, to take the issue of HIV and AIDS very seriously, because at some times they are a bit complacent and they think that HIV now is like any other illness, and people go back to live their reckless life.
Yeah.
Yeah. So we put these themes to reinforce the knowledge about HIV, to make sure it is still there, reduce stigma, to make sure people go for HIV tests, to make sure the politicians and all those in authority and power take the HIV issue very seriously, and to make sure that the future of our people is bright and people are aware of HIV. Yeah.
Okay.
Now, we have a theme for this year.
That's what I want to ask now.
Yes. The theme for this year is like, it's the same as for the past 2 years.
Okay.
It is about zero tolerance.
Zero tolerance.
Which means, actually, we want zero death. We don't want people to die from HIV.
Okay.
We want zero stigma. We don't want people living with HIV to be stigmatized. And we want zero infection. We want people to test.
Okay. So how many years the theme is on now? This is
26 years.
No, I mean that theme.
Oh, the theme, 3 years.
Yeah, 3 years.
Yes.
So do you think there is an improvement, a change?
Yes. When the theme started, we know that in the world will be about 33 million people living with HIV. And many of them, almost 30%, do not know they have it. Now, locally in the UK, we know that there are about 120,000 people living with HIV, and almost 25% don't know they've got it.
Z2 Magazine, Z2 TV, parce que ta vraie histoire doit être racontée par toi-même.
Welcome back. Yeah. We were talking about the World AIDS Day, where it's about raising awareness and you know, in the community. And then we said the theme this year, like 2 years ago, is zero tolerance. Yeah. So can you give us more information about zero tolerance?
Zero tolerance means we don't want to see anybody dying of HIV and AIDS. Zero.
Okay.
We do not want people to be stigmatized. Zero stigma. And zero, we want everybody to go for a test.
Okay.
Okay? We don't want zero transmission.
So is there any improvement as
for
before?
the past 3 years, this has been the same thing. And what we have seen is that, you know, in the whole world there are about 33 million people living with HIV. about a quarter of that do not know they have it. So we encourage people to test. And that number of people who do not know that they've got HIV has decreased.
Okay.
That is an improvement.
That's good information.
Locally in the UK, we have about 120,000, and about 30% didn't know they have HIV, and that has decreased to at least 20%.
Oh, that's good.
Yeah.
That's
And locally in Brent, where I work, about 40% didn't know they have HIV. And now it has gone to about 28%, which means that zero tolerance of transmission, and you know, the services addressing that are working.
Okay.
Yeah. Now, according to stigma, the level of stigma in the UK within the African communities has dropped.
Okay.
However, what we are seeing are the emerging communities, people who actually were not in our radar to know that they've got HIV. People from Indian subcontinent, people from Latin America, people from Eastern Europe. Now they are the ones who are suffering HIV/AIDS related stigma a lot. And these are the people we have to target.
Now.
Yes.
So what are you planning to do? I know it's not from you, the plan should come, yes, but at least are you including them in your action plan for the
yes,
coming?
Before I go there, the third point of zero tolerance is people dying. So medication has improved, and with the support to people living with HIV, they are getting better with the medication that is there. Okay. So people are no longer dying as before. So which means, you know, the theme is working. Now, coming back to your question about what to do with those emerging communities, that is our challenge at the moment. It is the challenge that we have. On the other hand, the authorities, our leaders, the commissioners says we don't have more money for prevention. And on the other hand, we're having these emerging communities. And that's the biggest challenge that we have.
So it's
however,
like you're in the middle.
Yes, given the resources, we have plans and strategies to make sure that even those emerging communities are involved within services provision to their communities.
Okay. Is there any issue regarding people who don't have paper, commonly, as he said, people who are not registered, yes, with any GP, they don't have their documents to, and they are not allowed to live, illegal immigrant, as we, yeah. So how do you deal with those margin population?
Well, the issue of illegal immigrants is a big issue. For example, there are so many people who came long ago from the Caribbean. They used to enter the UK without need for a visa, and they took it for granted. They have lived in this country for 30 years, but they have no papers. Now, if you find such a person, they may not be accepted at the GP, register with the GP. By law, they can get HIV medication, but if they have any other illness apart from, you know, HIV, they have to pay for it, and it's very expensive. So that one is a challenge. What we do is when we come across somebody who has no proper legal status in the UK, we encourage them and support them to get legal representation and legalize their stay in the UK. Right. And that's the only way we do it. We've got a list of HIV-friendly solicitors, we call them. They don't charge a lot of money, so we refer our patients to them, they support them to get papers put in place. It doesn't mean they all succeed, but at least the majority do succeed.
Yeah, okay. Oh, that's very good information. For those who are in those kind of situations, I think it might be good to find a way to get to you or other organizations to get those support and service to be, you know, more supported, if I can say that.
That's
all right. Yeah, thank you very much for allowing us to ask those questions. So what will be your last message, to those who are listening to us today?
My last message, as these days, is to encourage all people to go for an HIV test. If you get an HIV test and it is positive, then you can take opportunity or advantage of the good existing medication and control that HIV virus in your body. In that case, you will never be ill, you will never get to what we call AIDS. And you will be healthy, continue your life, continue having your family life, you continue get your job. If you are in education, full-time education, continue your education, which means life continues, and you get a good quality of life. Another message.
You have a lot.
I have a lot.
Yes.
Another message is to make sure that communities really get involved in prevention. Other communities, faith communities, communities of people speaking different languages, people from different cultures, get involved to educate their communities about HIV and AIDS. It has become easier, simpler. There are services out there. People have to access those services. And that's a message. Be vigilant. Make sure there is a lot of awareness and educate communities to reduce stigma.
Okay. We are in a period, in a seasonal period, where people, you know, enjoy themselves. So what kind of message would you like to pass through?
To the community?
Yeah.
December is a festive month, and I know everybody is enjoying, especially young people. Now, for old people like me, it is time to rest. But for young people, it's time for parties.
Yeah.
And you know what goes with parties. Relationships, people are having sex. So my message to everybody is that if you are going to have sex, have healthy sex. Protect yourself and protect others. Use a condom.
Condom. Okay. Is that your last?
The condoms are available at gun clinics. They are available in all clinics, accident and emergency, free of charge. But if you need them, you can even buy them from anywhere at very little cost.
Okay.
You know, filling stations, not only pharmacies, corner shops, everywhere you can get condoms.
All right.
Carry one. I've got mine here.
Hey, that's a good one. Thank you very much. Merci, chers téléspectateurs. Nous voici à la fin de notre discussion. J'espère que vous avez reçu des informations qui vous aideront à être vigilants, à avoir beaucoup plus une vie plus gérée par vous-même et non par ce qui se passe en dehors de vous. Donc, durant les fêtes, ayez une vie bien contrôlée et essayez d'utiliser le condom comme l'a dit M. Badru, si il vous arrivait d'avoir des relations sans contrôle. Donc, je vous remercie et pour toutes les informations complémentaires, n'oubliez pas de visiter notre website qui est www.jedodo.co.uk et nous vous passerons toutes les informations, même pour les condoms qui sont gratuits. Je vous remercie.